It's Valley Focus, and I'm Kayla Mortellaro, your guide for the program as we turn our attention here to Dr. Kate Purvis, ND with SCNM School of Medicine and Health Sciences. Thank you very much for your time today.
Oh, thank you for having me.
So as we dive into the conversation about flu season, COVID-19 circulating in the community, I first want to start with flu shots. Some of us haven't previously understood the importance of getting a flu shot, may consider themselves healthy enough to not need one, and kind of now with everything coming to light with COVID and flu season approaching, there is a now placed importance on getting a flu shot. So first, let's go through what is a flu shot and how it provides protection for oneself, but also slows transmissibility.
Yes, so the flu vaccine that is recommended annually prevents or helps protect us against circulating influenza viruses. So throughout flu season, which ranges from about late October to May, there are several strains of the influenza virus that circulate. The types that cause the most human illnesses are types A and types B. This year, it has been predicted that there are 4 strains, 2 type A and 2 type B, that are most likely to circulate. The vaccine that is developed each year, and this year it is developed to contain those 4 most likely strains. So getting the vaccine, particularly in the time of this pandemic, is going to be really important this year.
Dr. Kate Purvis, ND with SCNM School of Medicine and Health Sciences right here on Valley Focus. So you mentioned here the stressed importance on getting the flu shot this season to avoid what people are calling a twindemic. So what does that all mean?
Yeah, so we don't really know what's going to happen this year with COVID circulating going into the 2020-2021 influenza season. Towards the end of last year's flu season, so the 2019-2020 flu season, it seemed to be that there were elevated rates of influenza-like illnesses causing hospitalizations, suggesting that there may be a possibility of comorbidity. So it may be possible to have both COVID and influenza. But we really don't know the effects of having both viruses circulating at the same time. So we really need to be cautious this year.
Obviously, getting a flu shot is the element of trying to lessen one type of virus circulating in the community. But what does potentially having 2 viruses converging at the same time do to healthcare workers and the system?
Yeah, so it really can increase the burden on our healthcare system. We want to limit the use of limited resources and hospital space. So in order to do that, we have to continue our hand washing, our mask wearing, social distancing, and now adding that flu vaccine on top of that to help prevent the spread of both viruses.
What should we know about the differences between flu and COVID-19 symptoms? It's kind of hard to really pinpoint what COVID-19 symptoms can be, and then they all kind of mirror other things.
Yeah, unfortunately, it's going to be really challenging this year. They're both respiratory illnesses, and they often present with similar symptoms. In a lot of cases, testing may be really the only way to tell the difference. There's also a lot that's still unknown about COVID-19, which can make the determination difficult. So both flu and COVID can present with a really wide range of symptoms. Both can be totally asymptomatic. You may have no or really mild symptoms, and they both can present with really severe symptoms. Both viruses commonly cause fever, cough, and fatigue. The flu can cause shortness of breath. It does seem to be more common to have that extreme shortness of breath that we've been seeing in COVID. Both viruses can also cause upper respiratory symptoms, so sore throat, runny nose, headaches, and then also those kind of overall body aches. Both can cause vomiting and diarrhea, but that appears to be a little bit more common in children. And COVID also presents with that change in loss of taste and smell that we keep hearing about, and that we don't really see with the flu. So that may be one way to differentiate. But really, the best way is by testing.
And so that leads me to my next question. When should we think about getting a COVID-19 test? And also kind of furthermore to that point, as more businesses are continuing forth with their precautions, but maybe trying to get more people back into the building with mask wearing, et cetera, you don't want to expose your coworkers. So when do you kind of think about a good time saying, I need to go get a COVID-19 test?
Yeah, so the testing guidelines for COVID-19, they're changing really frequently as we get more information. But as businesses and schools reopen, it's going to be really important to kind of stay on top of the testing and those testing guidelines. So it is a good idea just to check with your healthcare provider or call us at SCNM Medical Center to double check. But those who have any of the symptoms that I just spoke about of COVID-19, if you've had any close contact with someone with confirmed COVID-19, and that close contact is within 6 feet for at least 15 minutes, or there may be situations where health departments or other healthcare providers are asking you to get a test. So those would all be scenarios where you would want to go out and get that COVID-19 test. But just make sure that you're checking with your healthcare provider if you have any questions about when you should be tested.
Dr. Kate Purvis, ND with SCNM School of Medicine and Health Sciences right here on Valley Focus. So you mentioned schools and kids returning to some sort of in-person sessions. Daycares are getting back full. Youth sports are returning. What should parents know when trying to make a decision about flu vaccinations for their kids?
So again, we really want to lessen the burden on our healthcare system, and that includes doing everything that we can, continuing that hand washing, mask wearing, social distancing, and then also getting that flu vaccine. So the American Academy of Pediatrics just released their flu vaccine guidelines this year. They're relatively unchanged from previous years. There's just more importance placed on following these guidelines because of the current pandemic. So the current recommendations are for everyone 6 months and older to get a flu vaccine during the 2020-2021 season.
And I've heard before that there's like a flu vaccination that you can specifically request if you're like over the age of 70. One, is that true? And two, is there then flu vaccinations for those maybe 5 and younger, or do they get the same strain as everybody?
So the vaccine for older adults, there are ones that are specially formulated that provide a little bit more of the active substances as well as more of the adjuvant. And that's just to promote a really robust immune response in older individuals who have a tendency to not have the typical immune response that you're looking for. In younger individuals, though, there's not really a different strain or different type of vaccine that's recommended. It is recommended that everyone over 6 months get a vaccine that's licensed for their age group. So at SCNM, we're currently carrying the Fluzone Quadrivalent for everybody over 6 months of age, and it contains the 4 most likely strains.
Dr. Kate Purvis, ND with SCNM School of Medicine and Health Sciences right here on Valley Focus. And when should we get the flu shot by? I mean, flu season maybe is a little bit different here in Arizona as compared to maybe back east.
Yeah, so flu season ranges from the end of October to May, with that peak being between January and March. And so even though because of our weather, we do see a little bit of that flu season being pushed back, it is still recommended that we get our flu vaccines by the end of October. So that's going to ensure that we are totally covered during that peak here in Arizona.
Is there anything you want to stress to the community about flu season, proper hygiene, when to stay home, and just overall as we try to navigate through the end of this season as well as with COVID-19 in the community?
Yeah, I think it's just really important that we don't let up on all of the great measures that we're putting in place to protect each other and to keep ourselves healthy. So making sure that we're continuing to wash our hands, we're continuing to wear masks, which is going to also help with the spread of flu, and that we're continuing to social distance and do everything that we can to keep ourselves and our community healthy and really thriving during this unprecedented time.
Dr. Kate Purvis with the SCNM School of Medicine and Health Sciences. For people that want more information or possibly get a flu shot with you, where should they go to get that information?
So you can go to our website at patients.scnm.edu or give us a call at 480-970-0000.
I greatly appreciate you taking some time with us today.
Thank you so much for having me.
Once again, Dr. Kate Purvis, ND with SCNM School of Medicine and Health Sciences, as you have been listening right here to Valley Focus.